Portage County Board of Supervisors meeting, recorded Tuesday, May 19, 2020.
Pledge allegiance.
Pledge allegiance to the flag, the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Invocation by Supervisor Reeser. I want to thank the clerk and the board for the opportunity to offer an invocation. And for just a moment, I'd like to take a break from COVID and take a broader look at the county. A multitude of human activities, including small industry growth, the highest installation of high-capacity wells in the state, home building encroachment on rural lands, the change from small to large-scale agriculture, and large-scale woodlot clearance have all significantly modified Portage County in the 5 decades I've lived here. The impacts to our resources are no longer a question for debate. The question, as a county, we must answer is, how will we respond to these changes? The physical climate of Portage County is changing. We have 4 less weeks of winter than we did 30 years ago. We have gained southern weeds, and we're losing northern tree species. But there's also evidence of a changing climate in public opinion and resolve. County residents are ready to insist on and be part of that necessary change. We as a board need to be ready to explore what it takes to remake and safeguard our county resources, fiscal and natural, as we face these challenges. As a new member, it's a little painful for me to see how split Portage County is. But it's good to recognize the different perspectives we all bring to the board. We can take these differences and utilize them towards common goals, guided by data and based on science. Let's move ahead. Thank you. Review and approval of minutes, April 28th, 2020. I'll take a motion. Motion by Supervisor Dubeck, seconded by Supervisor Johnson. Any corrections or changes? Supervisor Matt Jakowski.
Thank you, Mr. Chair. Under confirmation of Executive Operations Committee reappointments and appointments, on the second motion there, it says motion by Supervisor Moresi, Supervisor Gifford to amend, and then it has Barry Jakowski listed. Mr. Moresi's first motion was for me, so it should say Matt Jakowski. He then rescinded that motion and made the motion with Barry Jakowski.
Okay.
It wasn't to begin with, excuse me, Mr. Chair, if I may.
Supervisor Barry Jakowski.
It wasn't to begin with, Mr. Chair, and I do believe that the minutes should reflect the discussion that was had. And I would second Matt's motion.
All right. We've got a motion and a second to amend the minutes to reflect Mr. Moresi's earlier motion at last meeting and are you in agreement that it's either or? Because I believe I had to go back to Mr. Moresi without having this being replayed at that time because I had corrected Mr. Moresi because his motion was not correct. It was an option, and I had stated to him that it was his motion. He had to decide, and I think that's when he came forward with Barry. Is that correct, Mr. Supervisor Moresi? Does that sound more accurate?
That is correct. Thank you.
Are you guys agreeing with that?
What does the audio from that meeting say?
I believe it says what I just stated, that Mr. Moresi had earlier motion or first motion had been that he was motioning the either or Matt or Barry. And then later on in the discussion, I asked him to clarify his motion because it was his motion, not ours, and it shouldn't be an opinion. It should be a factual motion.
Then it should state the either or.
Correct, and that's what I had stated. Supervisor Barry Jakowski.
I would suggest that we go back and listen to the audio to make sure and
Bring it back to next meeting.
Yeah, I do know that Vinny had said either or at that time, or I remember, and from the video, what we can recall, we can certainly add that. But just as a side, we have not been putting discussion information in the minutes because that's not really something that should be in the minutes. It should just be motions, but we can certainly add that amendment.
But it was a motion that was made and seconded, and then the motion was made again and seconded. So that motion would have to be.
Right, and we can add that. I know Barry said the discussion included, and we aren't adding discussion anymore, just as a side note.
thank you, and I understand that, but I do believe the minutes should reflect what the
Yep,
discussion.
and we can do that, so.
Supervisor Laddick.
The conversation that I remember was it was either or, and then Supervisor Mercy said probably. That's what I recall.
If nobody has any further problems, we'll take these minutes back and bring them up next at the next meeting, and we'll listen to the audio and we'll put the correction in there. But going forward, as the clerk has mentioned, the records will probably not reflect word for word going ons during the meeting. So, Supervisor Johnson.
Point of order, because we do have a motion on the floor in a second, would that have to be withdrawn?
Yes.
I shall withdraw my second.
I had an amendment too that had a motion and a seconded as well. So thank you for that clarification. But I
will withdraw the amendment.
And I will withdraw my motion to approve the amendment.
All right, and Supervisor Dubek withdraws his motion, and Supervisor Johnson withdraws his second. I think we're all clear now.
Mr. Chairman,
Thank you, Mr. Chair.
Is Supervisor Pataki?
it's hard to hear the people way in the back and can't even understand what they're saying. Are they talking into the mics, or are those mics connected to us?
We tried to have that done today. Lee was working with, who was it, Lee? John from Stevens Point to try and accomplish that, to make sure that the mics were, and I had Lee go in and turn the mics up a little bit so the house speakers were a little bit louder to try and accommodate that. But I had also received an email from Joan asking all the supervisors to please use their mics because it's hard to hear at home. And Supervisor Pataki is also stating that. So for everyone's benefit at home, I know the two desk mics are hot, and the front mic and the back mic. So if going forward here, and we're going to have to get used to the new protocol for a while, someone's going to make a statement or raise their hand, please move to one of those mics. People at the front table have the luxury of being able to have one at there. So
We may be able to have all the mics feeding in for the next meeting. John and I were working on this for the last week or two, but we haven't been able to figure out who is responsible, I guess, for the equipment in here. John and I had reached out to the state, the clerk of courts, facilities, IT, and nobody seemed to know who could help us. So John tried to come up here this evening to get it set up really quick, and unfortunately wasn't able to do that. So.
all right, moving on. The minutes will be brought back at our next county board for approval. Correspondence.
WCA county revenue considerations.
It's the only thing we have for correspondence. Presentations. County Executive Holman, COVID-19 pandemic financial distress and budget planning. But first, we're going to hear from Ray. Will give us an update on the pandemic that led to the financial distress.
You want me here?
Fine.
Is that all right?
Can you come up to this one? I think because the camera will probably pick you up for the ones at home.
Well, that's what I was trying to avoid.
Yeah. You've got a mask on, Ray.
Remove your mask.
Can you hear me?
Can you bend that up a little bit more? There you go.
How's that? Ever better? Okay. So thank you for having me here tonight. Al asked me if I could just talk a little bit about COVID and, in the invocation, I heard he wasn't going to talk about COVID, and I said, I wish I could have one of those days. But so where are we at? Where are we at here in Portage County? So today, well, as of yesterday, we still sit at 7 confirmed cases. We've had 1,118 negative cases. We've investigated 1,281 cases, out of which 70 people were not tested at the time that they went in. And as you all know, our testing criteria changed. When this first started, you had to be either hospitalized or a member of a long-term care facility or a member of a first responder, EMT, law enforcement in order to get tested. If you didn't meet that criteria, you weren't getting tested. But we still did the investigation of 70 people that were presented for testing and were not. In addition, we have 84 pending cases right now that we're waiting on results. So what does that mean? Well, first thing it means is that it's here. Even though there's 7 cases, it's still here. If you remember, when this all started, which seems like an eternity ago, it started with where we entered this pandemic, and the state and locally, we were in a state of containment. And what that means is that, we were trying to prevent it from getting here. So we were doing everything in our power to try to contain that. Well, it had arrived, as we all know. So we entered into the state of mitigation. And what that is we're dealing with and minimizing the spread of the virus. Where are we today? Well, today we're actually moving into the phase of the pandemic of harm reduction. And really what we're looking for is we're moving forward with COVID-19 being present in our community. We could see an uptake in positive cases, and we would respond to any outbreak with our mitigation strategies, which are contact tracing to identify positive cases and placing them in isolation and quarantining those close contacts. So that's where we're at today. Historically, and this has all been shared with you, we know that in mid-March, there was a safer at home order. Then additional orders came out from the state, from the Department of Health Services and the governor that impacted a lot of different things. Some of the orders, some of them were not. Some orders dealt with opening up golf courses and others, dealt with retail shops and things like that. Additional orders that impacted various things that happened, and there was the extension of the safer at home order. That was what was tested, or that's what suit was filed by the legislature with the Supreme Court. So the state kept moving forward and tried to push forth mass testing. We did mass testing right here in Portage County. We tested 348 people, out of which we had 2 positive cases. Those cases were out of county residents. We could not limit our testing to only county residents because it was conducted by the National Guard and paid for by the state. So we had to allow anyone to come over. But out of the 348 tests, only 2 positives, both were from a county outside of Portage County. So then what happened? Well, on 5/13, the Supreme Court ruled that the safer at home order was not valid. And the one thing they didn't do, even though it was requested, was that they didn't issue a 6-day stay that the legislature who filed the lawsuit asked for. Well, what that did is that the order went away, but the virus did not. The virus is still here. But what it certainly did is it put local public health officials into a position to quickly react to a situation because it was all gone. So a lot of local, I shouldn't say a lot, but a number of jurisdictions extended the safer at home order. Then with guidance from the WCA and attorneys was told they didn't know if those were legally valid. So most of those jurisdictions rescinded their own safer at home orders. So then on 5/15, the AG issued an opinion in regards to what the local authorities were, or what authority the local public health officer and public health departments had. So we issued our own order on Friday, which was Portage County COVID Order number 1, or Portage County COVID-19 Order number 1. And really what it was as a part of our continued commitment to control the transmission of this virus. We looked at and we stated what our guiding principles would be. First and foremost, it is to protect the public's health. Secondly, we're going to use scientific data. So, and that any orders would be consistent with the established legal authority granted to local health officers under State Statute 25202, sub 1 and or sub 3 and sub 1 and 2. So we went about and we consulted. We consulted with our local law enforcement. We consulted with businesses. We consulted with a number of different individuals, and we came up with this guidance that was in the order. Okay, we talked about what you need to do as individuals and family. First and foremost, you need to practice safe social distancing. Secondly, all of the personal hygiene, washing your hands, covering your cough, and most importantly, stay home when you're ill. We did not issue anything as a direct order, but merely as guidance. And that was due mainly to the part of the fact that, we were looking at, we didn't know whether our orders were going to be legally valid or not. But we issued this guidance, and today we still stick by this guidance. We talked about in this order about vulnerable populations and what they needed to do. We talked about businesses. We met with businesses. We met with the Tavern League. We talked about the fact that they had to follow the WEDIC guidelines in order to safely open. We were not going to enforce it, but we strongly encourage it. I will tell you, in our conversations that we had specifically with the Tavern League, they had no problem with what we were saying. The one thing that we did recommend, we said that if there would be a positive test identified at a place of employment, we would ask that place of employment to close under our order, because we can do that, until all the members of that, or all the employees, of that business could get tested. And they could clean the facility. When we bounced that off of the Tavern League, they had no problem with that. They thought that was very reasonable for us to do. We talked about mass gatherings, and there's a lot of issues around mass gatherings, and what does that mean, and how are you going to define it? In our initial order, we defined it as 50 people. Some people said that was too much. Some people say it should be 10. But at the end of the day, what we looked at is that you can have a mass gathering of 10 or 20 or even 50. But if you're not practicing safe social distancing, people can still get sick even though there's 10. We also looked at, our enforcement and our authority, and that was our order. So where are we at today? Well, there's things coming out every hour, changes by the minute, and we are to the position where we are looking at coming out this Friday with what will be, I guess, round 2 for us. Lots of different issues are coming to our attention. What about daycares? What about the Boys and Girls Club? What about youth sports? A lot of those questions we don't have answers to yet, but we're working on it. We certainly, one of the things we're going to propose is that you might have heard through the Badger Bounce Back Plan, there's gating criteria. And some people have said, well, that state gating criteria, that has to deal with the 6 different issues, really doesn't make sense, because a lot of those issues don't impact Portage County. Because, one of the criteria is the presence of influenza-like illness. It's down here in Portage County, I will tell you that. But it's a red button in the state because there's an outbreak in the southeast part of the state. So what we're proposing is that we are going to look at, on a weekly basis, putting out our own gating criteria for Portage County. We are going to compare that gating criteria with the state. That gating criteria will include the testing and availability of testing for anybody that has any type of symptoms. We would look at the testing as the positive test as a percentage of the tests that we have. We want to see negative trajectory on both of those. We're working with our medical providers in the community to assure that they have the ability to treat all patients, and to look at, for our hospitals, their bed space, what they have available, and PPE, of course. That's another big issue, is with PPE. And so we want to assure that they have adequate PPE to move forward. And the last thing for our gating criteria will be our contact tracing. So that's one thing. The additional things that we're going to look at coming out, it will be to address some of those questions that we get on a hourly basis moving forward. And hopefully, we're going to be able to put guidance out around that. Will some of this look like an order? Very possibly it could. I'm not saying it won't. But at this point in time, there's just a lot of work to do, and we continue to do that every day. I'd be happy to answer any questions for you.
Mr. Chairman, a question for Ray.
Hang on, we got Supervisor Barry Jakowski got his hand up, Stan, then you. Go ahead, Barry.
I would reserve my time to Supervisor Pataki at this time, Mr. Chair.
Supervisor Pataki, go ahead.
Okay, question, Ray. If someone tests positive and they have to be quarantined for 14 days, let's say it's the husband and the wife, they live in the house together, they don't have any basement that's finished off, or they only maybe have like one bedroom or two. How do you quarantine something like that?
That's a great question, Stan. So, we certainly have recommended that if somebody has tested positive, that they try to isolate, and that's the part of isolation, as best as they can, their own room, use your own bathroom. But if you have a situation where you have a couple, but if they're both positive, Stan, to be honest with you, they're just going to do the best they can to just stay in their home and try to recover.
What if one is positive and one is negative?
If one is positive, one is negative, we would strongly recommend that the negative individual could not be in the residence. That would be our recommendation. And of course, it's a lot's going to depend on whether or not the individuals would need hospitalization or not, because that's always a possibility as well.
Okay, what if they don't know what to do? You get some older people who may not have any family and may not know where to go. What suggestion would you get to them?
Well, again, it'd be a case-by-case basis. I know that the university has offered some housing for people. I mean, again, we haven't had to address this, thankfully. But if we did have to address it, I think we would work on trying to find, the negative individual, if you will, a place to stay.
Well, I think you have a good point, and probably now is the time to check and see where you could send somebody. It's not a matter of when we're going to get it, or if we're going to get it, rather when we're going to get it. We're going to come up with somewhere.
We'll continue to look into that. That one, I've got to think is a small population would hit that stand. So hopefully nobody in Portage County ends up with COVID-19. But I'm sure Ray can find some place for you. Anybody else? Supervisor Barry Jakowski.
Thank you, Mr. Chair, and thank you, Ray, for your update. You mentioned that we had 84 pending cases. I'm assuming those are people that have been tested and the tests have not been returned yet. Is that correct?
That's correct. Yes, that's correct.
How long has the turnaround in Portage County been here for when the time elapsed from time of testing till determination of negative or positive?
So it really depends on which lab you're going to use. Now, when we did our mass testing, we had some results back within 24 hours. Other results took 72. So it just depends on what lab you're using. The state lab of hygiene, the two state labs of hygiene that the state uses, if you're going to that lab, we're seeing those results back typically within 48 hours. So,
thank you, Rick.
Thank you.
Anybody else? Supervisor Medine.
Their very compliant response. Thank you. How does it apply to the smaller retail? It applies to the larger retail. We all work within those confines.
Dave, they're telling me they can't hear you. Can you please go to the mic in the back? That's fine. Yes, please. He's going to go to the mic in the back, folks.
Thank you.
Sorry, Ray, you reported on the Tavern League and all of the people that are part of that and how compliant they have been, and I'm really proud of them for their response. How does it affect the smaller retail? And before you answer that, we understand the larger retail because we have all used those during this time in the grocery stores and all of those that are open. But how does it affect the small retail, and do we expect to be able to walk into the smaller retails around the county?
Absolutely. And so Dave, part of that, the Wisconsin Economic Development Corporation guidance addresses, each one of those type of businesses separately. I mean, everything down from hair salons to the small retail shop, and things like that. A lot of those businesses that obviously weren't considered essential at the beginning of the Safer at Home order. But I think most, I shouldn't say most, but just as important is the fact that every one of us as an individual needs to do what we need to do to assure that we're safe as well. And part of it is that, we've asked all businesses to post on their door, if you're sick, don't come in. We don't want you in our business. It's a tough thing for business people to say, I realize, but it is the right thing to do. And as individuals, if you don't see that, maybe you should question going into that shop. They have all talked about markings on the floor, because typically small businesses have like one register, if you will, markings, taping on the floor saying you've got to stay this far apart, just so we can assure that safe social distancing.
Anybody else? Supervisor Matt Jakowski.
Actually, Mr. Zastro had texted me and said that he was on via phone, but I see he has now showed up via internet.
Thanks.
So.
Since he used to be an IT guy.
Yeah, he said you used to be an IT guy. That's why.
Yeah, this thing told me they sent me the secret code and it didn't. There was some password, but anyways, go ahead, Matt.
Okay. Matt, that was
That's
it.
all I had.
Anybody else have any questions for Ray?
Mr. Chair, this is Supervisor Zastro. I do have a question.
Go ahead.
Yeah, Ray, I was reading the emails that Executive Holman had sent out recently, and in some of it, and it sounds like you and Gary Garski actually have the authority to, if things get kind of out of control, to step in and take some pretty major steps in potentially closing things down to some extent again. And how bad, I guess, would it have to get before you guys would step in and do something?
Well, that's a really good question, Jerry. And the authority rests with what is in statute under a human health hazard. So that's where our authority rests. But if we determine that there was an outbreak, and again, as I said, if we identify one positive case of an employee, we're considering that an outbreak, and we would ask them to close. Obviously, we're very concerned in regards to our long-term care facilities and our assisted living and things like that. But I will tell you that all of those across the board are continuing to do a really good job of not having visitors. I know that's really tough on the residents of those facilities not to see their loved ones, but they're really being vigilant about that. So I'm not going to tell you what the number would be, Jerry. It's a case-by-case basis, but certainly, if we had one in a business, we would take that action under our human health hazard authority to close that business.
And Ray, just to clarify that, you said close that business, and you had stated before that until the staff could all be checked out and the place could be cleaned. That doesn't mean it'll be closed indefinitely.
Absolutely not. It's just until all the staff could get tested, as well as they could do the cleaning of the place. That's correct.
Okay. Just for clarification. That answer your question, Supervisor?
Yes, it did. Thank you.
Yep. Supervisor Moresi?
Thank you, Mr. Chair. Can everybody at home hear me all right?
Yes, good, thank you.
Yep.
Yes.
Yes.
I guess my question is kind of taking along on Jerry's question. Now, when Attorney General Call issued his opinion on this, I guess, how did the county approach that opinion, since it seems that it kind of threw it all back into the county's laps and into Health and Human Services laps? And I guess what I'm wondering is, why wouldn't we have taken that opinion and at least executed the additional 6-day stay so we could have a very solid plan in place.
Well, thank you. Thank you. Part of it was that, the order ended on Wednesday night. We came out with our order on Friday afternoon. The Attorney General's opinion came out at around 5 o'clock on Friday afternoon. We did not want to wait because we thought that people in our community would want to hear something. So that we went down that road. And again, we worked with a lot of different parties in developing that guidance. It was just last night at 5 o'clock during the Finance Committee meeting, actually, that he came out with some further guidance, and that's what we're exploring this week as we move forward.
Supervisor Slake.
Well, first, thank you for not waiting on Friday to get that out there. I know there was a lot of small businesses waiting to hear something. Secondly, when did the Supreme Court hear that case?
Well, they came out with their decision on the 13th. I think it went to them almost about 2 weeks prior to that.
Yeah. Okay. Thank you.
You're welcome.
Supervisor Barry Jakowski.
Thank you again, Mr. Chair. And again, thank you, Ray, for helping small business get started. And I just wanted to say that I do believe the people in Portage County have done a very fine job of maybe soft opening. Many of the bars in our area have decided not to open. Many of the small businesses have decided not to open, due in part to protecting both themselves and our family members. I think the soft opening is a good idea, and I think it's kind of done itself here, may I say, in Portage County, where many businesses have felt that taking a wait and see attitude, and the soft opening seems to be happening by itself.
Yeah, I agree, Barry. And I had information coming from a very reliable source, maybe the sheriff, where he did some of that checking, and they were doing things all on their own. They were putting plexiglass up and things like that because, again, and part of that message is that, they want to succeed. We want our business to succeed. We want our economy to come back. And at that same time, so they're doing what they need to do in order to make their business successful, because ultimately it'll be the consumer that drives their business as success. So,
Anybody else have any comments or questions for Ray? Anybody at home? I guess I would like to say one thing, that during this time that we're fortunate to have the people we have in these positions, both Gary and Ray and Chris, as well as the sheriff. There is a lot that you cannot imagine that goes on behind the scenes. The information that comes down daily, hourly, and it's an update, and it's not a paragraph, it's several pages, and the information, or the avalanche of information that they have to continue to look at, and the decisions that we continue to make to try and be fair and responsible at the same time. I get to see a little bit of it, bits and pieces of it, but I know that there is many things going on. I just wanted to express my appreciation and response that what's going on, and that you folks are dealing with it and handling it, and we're lucky to have you folks in those positions. And one other thing is that so much of this that's going on, and there's so many people involved, that we've always talked at any disaster situation that there's one point of contact where the information comes out from. You don't get information from Gary or Ray or Chris or myself or the sheriff, or it's always trying to stay consistent with the message that comes out, because that adds to confusion to so much for so many people. So with that, if nobody else has anything, thank you, Ray.
Thank you.
Oh, Supervisor Barry Jakowski.
Thank you again, Mr. Chair.
Mike, please.
Said, where would we still steer people if they do have questions? To Executive Homans, to Ray's office?
I think it really depends. I mean, people, there's a lot of information on the county website. I mean, we still put out daily press releases, if I remember correctly. So there's lots of information out there, and my fallback is, just always call the sheriff.
Yeah, that was my choice. Call the sheriff.
Anything else?
No.
Thank you very much.
Thank you, sir.
Thank you, Ray.
Executive Holman.
Okay, thank you, Mr. Chair. And also to the question in terms of who do you call, it would depend on the nature of the question. And by all means, if it's about public health, give the Division of Public Health a call. That information is available on the website. If you have any issues with that, feel free to contact my office and we'll get to you as soon as we can. So today, we just wanted to kind of go through kind of an introduction to what are the financial stressors that the counties across the state are feeling. And just so everybody at home knows, I did send this to the supervisors. I knew who would be remote. So I apologize to Supervisor Muoff. She didn't get a copy of this yet, but it will be posted on the website after the meeting along with the minutes. So if for everybody else, we can follow along. At this point in the crisis and sort of the financial implications, we're beginning to see a fuller picture in terms of where we are and where we're headed. What I wanted to do today is try to give you kind of a nested, a sort of a Russian nesting doll version of crises, because really we have kind of a federal situation, a state situation, and then what we're dealing with at the county. So on the first page, we're looking at the near-term U.S. economic forecast, and even with the first quarter is when the coronavirus really came in, and when that happened, the GDP started to dip down. And for quarter two, they're already looking at, as you'll see, the Fed models are trending toward a deeper decline. 2 weeks ago was 35% reduction. Last week it was 43%. And this morning they're talking about 50%. And so what really is in question is what's the shape of the recovery? Is it going to be more rapid or is it going to be prolonged over time? There's an 8-week total jobless claims of 36.5 million people in the United States. In Wisconsin, we're looking at high teens currently as far as unemployment rate goes. As I said, the debate centers kind of on the shape of recovery. And we're expecting, regardless of what people think there, a general downturn through at least 2021. So a quick look at state impacts. The current fiscal year had early strength. And so what that means is that it set the state up to be able to navigate kind of where we're at now, in the sense that they're experiencing shortfalls, but it could also require a budget repair bill to be made by either the governor or the legislature, depending on who decides to take action. And what that means is that if there's a 0.5% shortfall on expenditures and revenues, that the statute requires that to take place. The Legislative Fiscal Bureau is already showing that there's an $870 million decrease or difference between April 2020 and April 2019. Overall, spread across the 10 months of this fiscal year, they're down $313 million. And so that will probably decline further because as we move forward through this, the crisis is worse. The state has received $2 billion in CARES Act funding to help with coronavirus. The bad news on that, I suppose, is that it can't be used for state revenue shortfalls. But the good news is that today the governor announced a $1 billion package to help with COVID-19 testing, contact tracing, supply acquisition, emergency operations, and resources for local communities. So we expect to see some of that money coming down. Counties have asked the governor's office if they consider sending some of that funding down to the local level. 30 to 40% of it has been what we've been requesting. The federal assistance to local jurisdictions seems unlikely. The Senate and the White House don't seem to be interested in that right now. And we'll see what happens with the current package that's going through Congress. The one thing to note about the federal funding as well, is that if we do get funding assistance that way, it will likely be offset through state cuts. So it's probably just a matter of when do you receive the funding. If it's federal, it'll probably be sooner. If it's through the state somehow, it'll probably be later. So big picture county impacts. And these are what we know now, and that's what we're keeping an eye on. And then we're using the tools and information that's slowly emerging to try to forecast and paint a picture for today and then looking forward to tomorrow. So currently what I can tell you is that the estimated sales tax losses, which is based upon forecasting from Ford Analytics, is anywhere from $865,000 to a little over $1 million. So we're going to take a significant hit in sales tax. Now, there is a dedicated or specific reserve for sales tax, but as you'll see, it's roughly $1.5 million. So if you end up at $1 million shortfall, that's the vast majority of that reserve, depending on how you use it. Now, I'll say this a lot through this presentation. The reserves are one-time money and hard to replenish. So however we use them, and they will be used, we need to use them judiciously. Interest income losses. So part of our overall fund balance drives our interest income. Also, of course, the interest rates were pretty good up until recently, and we were experiencing roughly $70,000 a month in interest income. Now we're at about $1,800 a month. So that gap is going to generate just another sort of shortfall in incoming revenue. And there's a lot of those too. Like some of these are bigger ticket items, but there's a lot of these, nickels and dimes here and there that are adding up and will pose some challenges. Net new construction, as you know, is what kind of dictates what our allowed budget increase is. So in a normal year, it's 0% or net new construction. Last year was 2.04%, which is not a high percentage by any means, but compared to the rest of the state, we were doing very well. Most are less than 1%. Some are less than 0.5%, depending on the county. But what we've done is started to roll out is look at what did the last recession look like. And so the finance director and I have had those conversations to say, what happened to the county in 2008 and 2009? And then how did that feedback loop look and how long did that reach? And so there's a lot of data there, of course, and happy to share any and all of this with you. There's a ton of data behind everything I'm saying, but suffice it to say that 2008 and 2009 led to negative net new construction for 2010 through 2013. So if your allowed budget increase is 0% or net new construction, you can probably look forward to 0%. We'll see. We're looking at estimated decreases in department fee income. Right now, we're ballparking 15 to 25%. A lot of forecasting tools are kind of looking at a 15% figure just initially to kind of help shape how we do some initial planning around these numbers. But just to give you an idea, 15% would be $2.8 million for the county. So we will experience shortfalls in the revenue here. How much it ends up being, it remains to be seen, but these are the numbers that we're tracking. Unemployment expenses, and we're happy to pay them, of course, but it's just a bit of a distinction because a lot of places will pay for unemployment insurance, and when people utilize it, there's a pool of money and whatnot that then gets utilized to fund that situation that person's in for however long they're there. The county doesn't do the insurance route. We're more of a pay-as-you-go, so we reimburse. So you generally can anticipate or maybe think about setting aside some money for that, but this sort of shutdown and then looking forward, not knowing how things may play out, the unemployment picture in general is just another area where we'll probably have some unanticipated spending. State budget cuts, I've referenced this already, but everybody talks about shared revenue. It's kind of like, it's the thing people talk about the most. Realistically, there's not a ton of places for the state to look to get the money they'll need for their shortfall. They're going to be looking at the UW system, they're going to be looking at schools, and they're going to be looking at shared revenue and beyond. But just to give you an idea again of if it came from shared revenue, we receive roughly $17 million this year. And so if that 5% cut, because the Department of Administration said we want a 5% cut across agencies, if that were to apply in some form or fashion, depending on how the state looks at this, then a 5% cut of that would be roughly $840,000. It could be more than 5% because a 5% cut across the board doesn't necessarily play out uniformly. It could be 7% here and 12% there and 3% there at the end of the day for however they're approaching it equals the 5% target. So where you fall as a line item in those, it matters. So impacts that are, there's more impacts, of course, and there's more than what I'm talking about tonight, but again, these are the broad brushstrokes. There's potential health insurance implications. I went through a survey today that was conducted. I think there were almost 800 participants. And the good news is that most people are seeing some stability there. They're not looking to change much of their program, which is good news for the industry because the industry is going to be looking at how are people using it, what costs are involved. And I've read at least one white paper from industry trying to understand these early sort of situations for them in general. So for us, that means that we are just, talking with Willis Towers Watson and our providers to say, let's keep this conversation going and see how it plays out. There's no sort of dramatic change to inform you of tonight, but it's just another one of those areas that we may have to work within. Now, on the health insurance front, we do have a reserve there as well, and so that could help cushion any blows if there were any, and it's dedicated to that as well. So in the sense that that money employees have put into that reserve can be used to ensure that employees continue to have as good a package as possible moving forward. There's significant implications in the healthcare industry for us. That's looking at Health and Human Services, countywide EMS, and the healthcare center. So for Health and Human Services, there's going to be increased need in economic support programs and other support programs just by the nature of the crisis. We can also expect an influx of referrals from mental health and child welfare, because in a normal year, right now some children would be at schools, there'd be more eyes on them, and you'd be able to track more of what's happening in these children's lives. That doesn't mean that we're not involved in their lives yet. We are, but it just means the nature of that has changed a bit because of the crisis. But as things move along, we can expect to get an influx in these areas, and that will be a challenge. And if you remember, the child welfare area was one where we had a roughly $500,000 deficit last year, and that was for last year's costs. So the state came through last year with $321,000. We still put a couple $100,000 in to make that area of the budget whole. But knowing that this is an area that is a challenge budgetarily for everybody in the state, to be honest, it will most likely be another area that we're going to have to really dig into to figure out how to manage any shortfalls. I haven't heard anything about impacts to countywide or to EMS programs. The federal government was kind of getting creative with different programs prior to all of this, because they know that they have to make some changes with Medicaid and Medicare. There's just too many things coming at that entity to pretend that the status quo can keep things going moving forward. So we're keeping an eye on that. It is National EMS Week, so we got to give a shout out to all of our first responders and EMS folks. They are on the front lines of this along with law enforcement and others, so thank you to them and everything that they do. And we are working with them obviously all the time. And in the healthcare center, there's, because of the crisis in the industry in general now, there's been, in some reports from Leading Age and others, a doubling of the cost in terms of taking care of patients. A lot of that's wrapped up in extra PPE costs, a changing the nature of the care, just because some of it gets, instead of doing like group things, you're doing individual things, so you have another employee on, that sort of thing. We've not seen a doubling in the cost, but we can certainly expect an increase in the cost looking at it. And the big picture here is that the reimbursement we get isn't changing. So any increase in cost is just going to exacerbate the loss that that facility experiences. And they're monitoring it. They're doing a great job. I will say that one of the probably major kudos to that leadership team over there, because statewide, a lot of these facilities are having a hard time holding on to people, and we haven't had staff problems. So even though CNAs are moving around, or people are having issues, or there's even been cases in or COVID-19 cases in some of these facilities, we locked down before any of this really started going. We've maintained that despite some public pressure, because the safety of those people in the home is, the highest priority, regardless. And so it's amazing watching them do what they do, and that they're maintaining the staffing the way they are. Moving on to delayed or lost property tax, there's a lot here that remains to be seen, of course, but one thing to understand about the county is that when we do a settle in full date, and as a part of the process, we as the county buy all of the receivables from all the taxing jurisdictions in the county. And so if you have a delinquency, or people aren't paying, or whatever it might be, the county settles in full with whoever that taxing jurisdiction is, so they're made whole, and we take the things that need to get sorted out. So if there are delinquencies, and again, we looked at this in 2008 and 2009, roughly back then we saw roughly 85% collection rates, so it was down. We can probably anticipate that again. What that means is that what doesn't come in this year will play, there's a 3-year process through which people can pay this off. And so the idea is that you'd be able to try to recoup some of those losses over that time frame. Now, there's no guarantee you would, and if you don't, then we issue the tax deed, sell the property, and generally we'll take a loss on that. But the point of this is that if the loss that we may experience will get carried over into future years, so it's not something that resolves quickly or easily. The Act 185, which the board passed last month, that postpones the date to October 1st. So this year we'll be settling in full on September 20th with all taxing jurisdictions, and then we won't know what has come in until October 1st, and plus a grace period, which I think is a week. So we'll be settling in full with everybody before we know what we have. That doesn't pose a huge challenge, but it's something that we're obviously keeping in mind as we look at that. The other part of it is if there are still people who are delinquent after the October 1st date, then, or even in between, we're foregoing the interest and penalties. And by doing that, which is a great thing that we did in terms of passing a resolution and giving these folks a break, is that it's for the whole year, like February up until that point. And so it ends up being roughly $80,000 to $100,000 in addition to everything else that we volunteered to let go as part of that, which I think is something that government can and should do when we have the ability to do it. Grant program questions. There's a lot of ins and outs to this. I just wanted to touch on 2 of them, and essentially, if there's work going on in a grant and then there's a statewide shutdown and people have trouble completing all the objectives for the grant, there may be issues with that grant program in terms of, do we get all that funding? Did we meet all the objectives? Now, nobody's doing anything wrong. It's not like employee X was delinquent in doing their job. It just means that the circumstances that the grant exists within didn't allow for the work to take place. Same thing is that a lot of people who are in the county are employed with grant funding, and they're not covered on unemployment through grant funding. So we're picking up the unemployment piece if they've been laid off as part of a grant. But the question now is, if there's an unemployment cost associated with that, will the grant allow any funding from the grant to offset the unemployment costs? And we don't know yet, but that's what we're looking at. So budget planning. Jenny and I are talking all the time about this. You know, it was Monday, Tuesday, Wednesday last week. We were really digging into this, and then the Supreme Court happened. So last week was quite the doozy with sorting through all this material and then sorting through all that. But just again, really trying to set the tone for this year, and I'll be very frank with you, the near future. We're going to have to be wrapping our minds around some complex challenges, and we don't have a lot of tools, and I'll explain why. So conservative estimate right now would tell you $4 million loss. So there's lots of ways we can navigate that, but that's what we're looking at in terms of, again, a conservative estimate. It's likely that number will go up. The good news is that because the county's been prudent, because the county's maintained its fund balance, because it stopped paying for operations out of the fund balance, all these moves that the county board has taken over the years and that Jenny has shepherded everything along with, has left us with a fund balance that puts us at a good starting point. And I'll tell you right now, there are many counties who are not in that position. And that will pose a challenge for them. And it's a huge question for the state to figure out what are they going to do. But we're in a good position. We're not operating in a crisis mode, worrying right now, okay? We are afforded the ability to sit back, take a deep breath, look at it, really dig deep into the information and figure out where are we going, what's in front of us. I mentioned it before, but fund balances will be used, but I'm also reluctant to use them too much, because not knowing the future, we're going to need that, right? And it's also something we're going to need for anything else that comes down the line that we don't anticipate. We had storms last year, we had floods, who knows, a tornado could come through. There could be any number of things that generate unanticipated costs that we're going to, and maybe some of it's reimbursable from FEMA, probably not a lot of it, but nevertheless, you'd still need to float that gap period with some sort of funding. So we need to manage the fund balance effectively. It's easy to just say, we'll just take it all out of fund balance and hope next year's a really good year. I don't think it will be. And I noted there at the end that the fund balance at the end of last year was $16 million. Just to give you context for that too, because, when we come into this position, I don't know if it's the same for you, but for me, talking about $16 million 3 years ago, I was like, no, $60 million is a lot of money. And it is a lot of money. But in the grand scheme of county operations, it can go quickly because we're talking about a lot of things happening. And so getting comfortable with the idea of what does that mean for us, the context piece here is that when we did the emergency paid leave for employees, a 2-week payroll for the county is roughly $1.5 to $1.8 million. So if the only thing you had to do was pay your employees and all you had to pay it with was this, you'd have about 5 months worth of salaries. So that hopefully gives you an idea of, yes, it's good, we have a good cushion, but we need to be careful and thoughtful, and we are. Future budget decisions, past budget decisions have been data-driven as well, but we're mentioning it now because I really want to emphasize that it's going to be more important than ever for data to drive the decisions that we make. So we're looking into forecasting tools. We're looking into how to use our current system to, instead of doing a 1-year budget, we can do a 2-year or a 3-year just for planning purposes, right? We're not going to come to you and say, approve a 3-year budget, but it gives you a tool to say, here's where we're at, here's what we plan for next year, and here's what that follow-on year looks like, assuming all of these things stay the same. And it gives you more of an idea of where you're headed. And the reason we're really stressing this is because everywhere you looked in the last recession, especially over in Michigan, Detroit, the car industry, every municipality that looked at their situation and said, we can see something coming, and they planned around it with data, they did way, way better than all the municipalities who didn't do anything. And then they ended up, defunct in some cases. So in addition to that, we've got the budget prioritization process. Initially I wanted to do that pretty quickly. Clearly it made sense to stretch it out. So last year we compiled all of the discretionary programming in the county, figured out where does it rate within a department, and that will fold into the process in terms of I'll get it through the finance committee. I'm going to give them all of that information. Any of you who want to see it are welcome to it. It's a sizable chunk of paper, so just know that, or a big file on a computer. But over the time that we have to think about this, getting comfortable with all that information is going to be key, because if we have to start making decisions about cutting services and programs or reducing services, we'll have an idea of, we're talking about X department, Y service. We've already done the conversation about what that looks like and what does it mean. There's all kinds of other options we can use. We're looking at all of them. You could, for example, you could have a hiring freeze. If people retire, you could say, well, we're not going to replace somebody who retires. You could say we'll have strategic furloughs. There's all kinds of ways to try to chip away at the overall issue. And so the conversations we'll be having moving forward will look at all of them and figure out, are they good, bad, ugly, and why? And then bring that to the committees. For this year, we're constantly evaluating things now. We've asked departments to look ahead and forecast revenue shortfalls and get that back to us so that we can kind of get our heads around what does this year look like. The good thing is that this year has been budgeted, so we know that we had the money. We budgeted this year. We're moving it through, but that doesn't mean that there won't necessarily be adjustments that have to be made. And that kind of gets also to the WCA memo that was in your packet. They talk about county cash flow and other financial tools. And just so you know, we've met with them and their team and their financial company to provide feedback from a county to say, here's what we're not seeing in your tool. Here's what we're not seeing in the overall suite of information that you're trying to use to create something for all 72 counties to use to monitor their cash flow and do this budget planning. So we are a part of that process. We continue to be, and we've already talked to them about engaging in some of these programs to, in addition to everything else, help us get through everything. So that's the brief version, and certainly will not be a one-off. I'll be bringing you information constantly so that you are all kept up to date with that. Similar to at the department level or committee level, bringing any issues there. And so far, the budget planning calendar is roughly the same. So expect to start hearing more information as we move forward.
Supervisor Barry Jakowski.
Thank you, Executive Holman, for that update. Not being part of the Finance Committee at any point in my tenure here on the county board, I did not realize that we were self-insuring when it came to unemployment compensation. Could you expand on that a little bit? And do we have a lot of personnel laid off at this time?
No, we didn't actually have a lot of personnel that ended up having to be laid off. The people where it hit the most was when the library shut down. So you had circulation aides, and we talked with them. They said, well, look, we got all this work we can do to catch up on things that piled up. So I think they had about 10 days of work that they kind of caught up on a lot of stuff. And then at that point, the work was gone. So then some of those layoffs started to happen. The other place was the ADRC, because their target population is the most vulnerable population. So people weren't coming in, the programs were shutting down. And I think the last number I saw, we were roughly, and I think 43 people who were anywhere in the process of unemployment. And that would be either through us or through the federal program, the Families First Coronavirus Relief Act funding, which provided relief for people who needed childcare, for instance. And then there were individuals at the ADRC as well who were still available to work. And so then we reached out to the healthcare center because they had some need for additional assistance, and we redeployed those individuals to the healthcare center. So we created opportunities for redeployment. Some people took advantage, and that's still a tool that would be in play moving forward. But as the library is looking to reopen at some point in the near future, they're going to again call people back in probably 7 to 10 days prior to get everything back up to speed, so that when the doors open, then that they're ready to go. Those are the two main areas. You'll have to forgive me. I didn't come prepared to talk about the detail. There might be one or two in other areas, but those were the drivers in terms of unemployment.
And of those 40-some employees, are we around 650 total for the county?
It depends on the time of year. The document I signed about 2 months ago that logs every employee we have through the course of a tax year said we had 722 employees in the tax year. But yeah, to your point, roughly 550, 600. So a small percentage of employees. Most people we could get teleworking or rotating shifts or doing other things. And, a lot of the county work that needs to get done, that's why government was essential, wasn't shut down. We were still smart about it and trying to, shut down buildings, things like that, to put employees in the best position possible. But yeah, overall, not as bad as it could have been.
Mr. Chair and Executive Holman, if I may, my reasoning saying that I was never part of the Finance Committee wasn't any complaint about not being part of the Finance Committee.
Careful what you
ask. It was
ask.
only explanation for not knowing why we weren't.
Careful what you ask for.
Thank you.
Anybody else have any comments or questions? Supervisor Medine?
It's a quick question, but out of respect for everyone, I will use the microphone. In 2009, we took a fairly quick response to have a hiring freeze, as I recall, which would be at about this stage equivalent. Have you talked with department heads about that as a possibility?
Yeah, no, it's a good question. And even before this happened, every position that needs to be renewed or hired goes through a process where it's approved by HR, finance, and myself to make sure what is it. These days, it's mostly CNAs, or is there a way, is that work only done by that person? Is it statutorily mandated? Are there other ways to do the work? These are the questions that they have to fill out a form and answer so that we can then review the position. So that process remains in place, and In terms of hiring freeze, it's definitely on the table. Same thing with furloughs. I mean, there's going to be all kinds of questions to answer this year as we move forward about salaries and everything else. Like I think the more you can spread it out through different tools intelligently, the better off we'll be. But yeah, we haven't had a formal discussion. Like this information, I brought up to the EOC last week on Friday. Said, here's what we're talking about. Here's what we're seeing. And then on Wednesday's department head meeting, then I brought it to the attention of all department heads and said, here's where we're at. So the conversation countywide is just getting going. And so that will be something we discuss. And I mean, we'll be discussing it at HR committee and elsewhere too.
Supervisor Gifford.
I'll use the mic. I hope the people at home can hear me. With regard to the big picture, the national picture, your first page, it mentions, are we going to have a V-shaped recovery? One thing I've had a lot of time to do, in the lockdown is digging through the peer-reviewed economic literature, the stuff, on Google Scholar Search and stuff. We didn't have a V-shaped recovery from the 2007, 2010 crisis. We had basically what they call in the literature secular stagnation, which means it's not non-religious stagnation. It means a long-term cyclical period when something doesn't change, right? So looking forward to the next decade, I would say, people who are saying, oh, everything will be recovered by the end of 2021, I think are really, taking magic dust or something, because the concept of this secular stagnation is that it is the income and the people at the non-elite level of the working force, plus the people not in the working force, that is what drives your economy. That's what drives your GDP. 70% of GDP is consumer spending. Who are the consumers? They're the people who work for a living or don't work for a living and put on their consumer hat and go spend some money. So to wrap it up, I think we're going to, looking at, you've been part of Portage County Prosperity 2040. This is going to be one heck of a setback for prosperity in Portage County. And I think you're going to see a big chunk of our middle income people shifting into the low income people category. And it's just the amount of stress that people are going to be under community-wide, county-wide, statewide, nationwide. And they are going to be looking to government for some sort of way out, some sort of relief. So I think that the long-term planning has to be really, really long-term planning, and the concept of Portage County 2040 really takes on a whole new meaning now, and I look forward to working with you on that in the future.
No, thanks. And I would agree. The V-shaped recovery is, in my opinion, and I'm not an economist, full disclosure, optimistic. There's when it gets into the politics, generally this side's saying V-shaped, that side's saying probably prolonged crisis. Most likely it's going to be some sort of rockier ride because everything's going to ebb and flow with a lot of things that we don't know much about, in terms of what the virus does, where does it go, how does it impact things, in addition to anything else that takes place. So yeah, on top of that, the federal government, I think, what have they spent, $6-7 trillion, and they're contemplating another $3 trillion. So I think they've stepped up to try to provide that financial support in this crisis environment, but they're also kind of reaching, or they're past the point, or long past the point where that assistance is going to help in the long run, right? In some cases, the more they help, the deeper their problems are going to get, which are our problems. So then I'm not anticipating that sort of thing is going to continue, because I don't know how long it could. And same thing with the state. You know, we've been under a levy limit for well over a decade, depending on when you want to start counting. So the state hasn't been kind to us for a long time, and I don't know that they're going to be kind to us now. So I'm not counting on a whole lot from them, and that's kind of the point of looking at the fund balance, using it judiciously, and then trying to get a long-term perspective with as much data and information we can bring to bear. And, you know, it's similar to the crisis with the virus and vaccines and things like that. One of the silver linings is that the entire planet is working on that, right? So you have every smart person in the world literally working on that situation, which doesn't happen very often. In this context, you've got at least 72 other counties and plenty of municipalities who are in the same boat. So we're all going to be asking the same types of questions, and those conversations are going to help. You know, there are going to be some good things that come out of that, despite the rough situation we're in.
Anybody else? Anybody at home?
Mr. Chairman, just to let you know that I have a split screen, and the one on the right that goes down on you and Kayla is blurry, and you used to be kind of going from back and forth here and showing different parts of the courtroom. However, that has flipped, so I can see all the supervisors, almost all of them. But the right part of the screen is just blurry, so it's got nothing went out of focus or something.
Duly noted. Next presentation, Corp Counsel David Ray, Supervisor Orientation and Information.
Thank you, Mr. Chair. Can the people at home hear me through this microphone?
Yes. Yeah, just fine.
Thank you. Before I
But
talk
if we
about
get that camera
orientation,
focused, that'd be nice. Then we can see you.
I can't fix that. Oh, you can see me?
We can't
Well,
fix
we can
that.
see you, but you're out of focus.
We can't fix that. We don't have the ability tonight, and the staff that's usually here that runs the cameras, or isn't, if we knew who it was that was involved with the cameras, we're still working on it. So
Can you make the other one out of focus then?
they are, yeah.
Just kidding.
Thank you.
Thank you. Real quickly, before I talk about orientation, I thought the board would also appreciate knowing, and this is tag teaming and adding on to some things that Ray Shabilsky said and shared with you. In addition to everybody that he mentioned and that the chair mentioned, for about the last 2 months, there have been other groups of county staff that meet on a regular basis. And the three that I'll quickly share with you and point out to you are, we've got a public information officer team that consists of anywhere from 6 to 10 people that are on the phone with each other or in web meetings once a week for sure. And now we've been meeting more frequently recently. We're meeting usually twice a week. The Emergency Operations Center also meets 3 times a week on a regular web call. And Executive Holman meets once a week by phone with all department heads. So all of those things are going on a regular basis and have been going on for the last 2 months. And we're all able to keep each other up to speed and communicate in pretty close to real time so that we keep up with what's been going on around not just the county, but the state and the country. So just sharing that with you. In terms of supervisor orientation, I sent an email out to all of you this afternoon. If you haven't seen it yet, check your inbox. I attached 2 different documents to it, and I did that in an effort toward not saying very much tonight. If you've got questions about any of the things that I attached, give me a call, send me an email, whenever. I mean, tonight, not tonight, tomorrow, next week, next month, whatever. I may not always be able to answer the phone when you call, but I'll try to talk to you within a day or 2 if you have questions. Reach out to your fellow committee members, especially for new supervisors. As you're learning the process, you can get a lot of information that way. Be careful, however, though, and this is one of the talking points in the PowerPoint that I share with you. When you talk to other members of your committee, you have to be careful not to create walking quorums. You can talk about procedural things generally with your committee members. What you really have to be careful about, though, is talking about things that are on an agenda for an upcoming committee meeting. It's kind of like the Vegas saying, what happens there stays there. The same thing is with, committee business. It ought to get transacted and conducted at the committee meeting, not outside of the meeting. So if you have questions about walking quorums, I'm happy to discuss that with you. There's a couple of slides in the PowerPoint that I sent you about that. The other thing to be really careful of is there's a couple of slides in the PowerPoint as well about open records law. And generally, supervisors don't have to deal with open records law requests or responses to requests for information under open records. However, anytime that you're communicating with others in your role as a supervisor and you're signing it, John Smith, Mary Smith, supervisor, that is a public record. So that's why it's important when you do that, use your county email. Don't use your personal email, because you don't want to make your personal email subject to an open records request. The other thing is, be wary of social media. That's not to say that you can't have it or participate in it, but if you're wearing your supervisor hat when you do that, you've got to watch what you do and say. My rule of thumb that I've always followed, even before I came into this position, because I advised other governmental clients, especially townships before this, if when you're communicating about something that relates to your official business, if you'd be embarrassed or don't want it to appear on the front page of the paper, don't say it. Otherwise, anything you say or anything you put in writing, if it shows up in the paper, as long as you're doing it the way you ought to and handling it the way you ought to handle it, you're okay. Thank you.
Any questions or comments for Corp Counsel? At home? Anybody? No. All right. Thank you. Public notice. Members of the public who wish to address the county board on specific agenda items must register their requests at this time with such comments subject to reasonable control of county board chair as set forth in Robert's Rules of Order. Anybody from the public? Lee, anybody from the web? No. Confirmation of county executives, reappointments and appointments. If there's no objections, I'll take them all in one motion as printed. Motion by Supervisor Rakowski, seconded by Supervisor Splinter. All those in favor with aye? Aye.
Aye.
Opposed? Motion carried. Confirmation of Executive Operation Committee reappointments and appointments. Same thing. If there's no objections, I'll take them all in one motion as stated. Motion by Supervisor Matt Jakowski, seconded by Supervisor Gussel. Discussion. All those in favor with aye? Aye.
Aye.
Opposed? Motion carried. Duly noted, Barry Jakowski. Reappointment reports and discussion only. The following reappointments were approved at Executive Operation Committee on 5/6. Following the meeting, both individuals withdrew from their reappointments. That was Andrew Lind was reappointed and Andrew Helverson to the Advisory Committee for the Central Wisconsin Airport. The status on this Advisory Committee for the Central Wisconsin Airport Board is currently being reviewed. This is one of those committees that reports to another committee that was created back in 2014. It doesn't even have an ordinance number to it. It's kind of an oddity. I've looked back at the minutes before to see what kind of things happened for their agendas, and they took tour of the kitchen and some other items. But I believe Supervisor Laddick was at the last meeting. I had asked him to follow up at the highway meeting, and they are going to put it on their agenda in the future. Supervisor Laddick?
At the Central Wisconsin Airport Board, I had talked to them.
Can you use the other mic for the folks at home?
Yeah.
In reference to the airport advisory committee, I was at the Central Wisconsin Airport Board joint meeting with Marathon County last Friday morning, and we unofficially, after the meeting was done, had talking about the impact of that committee has. No one had any exception, and there were two of the members from Marathon County there that were on that advisory committee of eliminating that as far as Portage County goes, and they have no official backing from Marathon County Board either. It's kind of a quasi advisory committee that kind of got together unofficially, but we kind of took it upon ourselves to make it semi-official, I guess. And so as the discussion went on, everyone felt that they would be better off to go through both business councils, both Marathon County and Portage County, and operate through them, and maybe be a more of a direct advisory to the airport manager at Central Wisconsin Airport. Mostly where business travels. I talked to the airport manager at Central Wisconsin Airport. He said the only thing that they really took away from that committee that he's got from them is they came up with a survey, and he kind of relayed that to the airlines at that, and that was like 2 years ago. So at this point, I would say we can officially eliminate that committee.
Thank you. I just wanted to give you folks an update. Stay tuned. It's in the works, and that's what's going on there. The status ordinance required 3 business people that use the airport, and it was hard to find business people that use the airport that wanted to be part of it. We had Andrew Halverson, the past mayor of Ellis Stone, and I don't know if Ellis Stone does a lot with the airport or not, but as one of the past appointments. So that's just an update. Stay tuned. Resolutions and ordinances. Number 1, amend Portage County Ordinance, Code of Ordinance, Section 3.1.9, resulting in the clarification of the procedures for selecting and appointing citizens members to the executive operation committees. This one is housekeeping. I need a technical amendment as well. But some of the background, we did not, when this was changed, we did not have a mechanism in the ordinance of how to appoint the citizen members to it. So that's the clarification to it. So the technical amendment, and I will need someone to make a motion. Bear with me. It's in the first, second, and fourth whereas. Okay. The first, second, third, and fourth, whereas you see executive operations, wherever it's mentioned, it doesn't have a / between executive operations. And is this the other one? Yeah. And the third. Yeah. And the other technical amendment is in the third whereas. On the far right side, it's the 3.9.1L below the Executive Operations Committee. Supervisor Barry Jakowski.
Move to make those 2 technical changes, Mr. Chair.
I have a motion. I have a second. Seconded by Supervisor Splinter. Any other discussion on the amendment? All those in favor of the amendment, say aye. Aye. Opposed? Back to the original motion as amended. I'm sorry. Yeah, we need a motion by Supervisor Moresi, Need a second. Seconded by Supervisor Morrow. Now, any other discussion on the amended motion? Got that kind of backwards. We're a little rusty, folks. Who made the first amendment? The amendment was Barry and Mike Splinter. Barry, would you amend yours to also include the track change on the back page? It also has to be the 3.9.1L has to be corrected on this page as well.
Thank you for pointing that out for me, Mr. Chair. I certainly would.
Yes. Supervisor Splinter, would you amend yours? Okay. We have to take a motion on that, or have to take a vote now back on the amended and clarified amendment again. All those in favor with aye? Aye. Opposed? Opposed? Amendment carries. Now back to the original motion as amended and clarified. Any other discussion? All those in favor with aye? Aye. Opposed? Motion carries. Number 2, resolution petitioning for the Secretary of Transportation for airport improvement aid. Motion by Supervisor Laddick. Seconded by Supervisor Reeser. Any other discussion? All those in favor with aye? Aye.
Aye.
Opposed? Motion carried. I will take a motion to adjourn.
Mr. Chair, before we go.
Oh, Supervisor Barry Jakowski.
Thank you, and thank members of the body. I think it was approximately 2 months ago, we enacted, I believe it was, we called our executive powers as a board, allowing both yourself, Mr. Chair, and Executive Holman. Do you believe, and I guess I'm going to ask the body, if next month, depending on how the soft opening goes, that we could maybe discuss going back to, for lack of a better term, normal? Or am I ahead of myself?
Back to normal in what regard?
Well, I would assume rescinding the executive powers and things going through committee.
Well, yeah, we can bring it back to, we can put it on the agenda.
And again, I do believe that we will know more in a month's time as we open, whether there's a resurgence of the virus and we maybe have to go back to, but we may know more by then. And I think if nothing else, we could discuss it if that's okay with the other members of the body.
Yep. We'll put it as a future agenda item. Supervisor Reeser.
I wonder if that could be clarified for new members. I'm not sure what Barry is referring to in terms of going back.
Supervisor Holman. Executive Holman,
Maybe
sorry,
one day.
demotion.
No, it's a good question. Essentially, in the very early days when things started to ramp up and it was pretty certain that some dramatic sort of moves were going to start happening at a state level, we brought a resolution to the board to say, well, first let me qualify that. So like we have an executive form of government, so there's different things that play here. So under Chapter 323, I have certain emergency powers. But that all being said, at the time we hadn't had a case of COVID-19. And so in discussions with public health and others, we thought, well, as we progress, let's wait to declare an emergency until we have a case to kind of accentuate the fact that, okay, now we have a case. It's a declaration of the emergency and a way to really inform the public again about the situation. We ended up declaring beforehand, but nevertheless, the resolution that went to the board was to ask the board to give me and the county board chair, more administrative flexibility. So that resolution passed prior to the declaration of emergency powers. Essentially, and correct me if I'm wrong, Dave, but essentially what it did is it actually even put requirements on me. and I brought it because for me, it was like important that we work together and that we show the county that we're working together. It didn't necessarily grant any additional powers per se that we would have in an emergency. Nevertheless, the only reason I mentioned that is because if we do pull it back, and there's no reason not to discuss that or to look at what are the implications. I can tell you too that because of sort of the statutory ambiguity or let's say lack of clarity in terms of what local jurisdictions can and can't do, there are discussions ongoing about what does Chapter 323 give counties who have an executive form of government the abilities to do in this situation. Either way, that's kind of a real nutshell version of the different chapters at play. But there's even other pieces in terms of looking at the body of law or ordinances at the county that we'll bring back for the same sorts of reasons. So that's the resolution was passed. It required me that if a policy change was made to communicate that to the board within 24 hours. And that then at a future meeting, the board would take up the changes and review them. So that was the intent. The intent of it was to show we're working together, provide administrative flexibility before the emergency was declared, and then afterward, it still meant that I needed to be communicating with you. I was going to do it anyway, but again, it's still a good way to formalize it. It's a good, I felt very good about the resolution. So,
Chris,
does that answer your question?
It does. So if I understand this, it allowed things to be expedited out of your office.
Correct. In consultation with the chair and HR and corp counsel, and we were in that moment where there was a lot of anticipation and no real understanding of what exactly was going to transpire. So needing to be nimble and adjust on the fly. And the first thing out of the gate was 800 pages of federal legislation slapping on your desk, and now you have to craft a policy that everybody's like, what's going on for the county? So that being able to put in all the overtime and really dig into it and figure out what it meant, that window gets narrowed if you can have the flexibility and not necessarily have to go through the normal structured process. Not to say there's anything wrong with the process, it's a great process, but that was the intent.
Understood. Thanks for clarification.
We can try and if anybody wants to, they can probably go back to that was in our March county board and pull up the agenda, and the resolution would be in there from the past. Yep.
I affectionately call it the St. Patrick's Day resolution.
Yeah. But one other point was, and we're going back here just 2 months, but it's I believe that the way we are set up in Portage County with an executive has the authority during a declaration, has a lot of authority, and by having that resolution, it actually he was giving some of it up in a check and balance by having to have the county board chair sign off on it as well. So, Supervisor Barry Jakowski.
Thank you, Mr. Chair. And just to clarify, my asking of that question was in no way to say that I was dissatisfied in any way, shape, or form of the way the team functioned. I just thought it was a nice topic to bring back up depending on how our soft opening goes. Again, no way, shape, or form was I dissatisfied in the way the team operated. I think we did a tremendous job here in Portage County, so thank you.
No, and again, I didn't take any, and I don't believe Chris did either. But at the same time, I know that we both didn't know what was to come, and we wanted to have all the tools in our toolbox to allow the government to move forward and us to not have legal challenges later on during that. And we had 2 items that actually did come up where we had enough time, and the committees were able to take a look at it and give it its blessing, and then we move forward with it. So again,
I thank the whole team for their response.
And it's all new territory for all of us. So it was used wisely. So, but it probably is well within our time to talk about it and discuss, because now we are getting closer to what the new normal looks like. So I will take a motion to adjourn.
Mr. Chairman,
He's Supervisor Pataki.
just to let you know and thank whoever fixed it, the right side of our screen is now clear. We can see you clearly. So thank you.
Well, you're very welcome. I took care of it. I'll take a motion to adjourn. Motion by Supervisor Moresi, seconded by Supervisor Splinter. All those in favor with aye? Aye. Opposed? We're adjourned. Thank you.
A video of this meeting is available for viewing on the city's website, stevenspoint.com/videos.